Hello, Dr. Webster again. Okay, we're going to talk about the relationship between being overweight or obese and heart disease. And I don't have to tell you, it's a big factor. And I read where, 40 to 60% of Americans are either overweight or obese. I mean, we have a real problem in this country. So I'll pull some things, again, from medical sources. What does obesity or being overweight, what does it do to your heart? Of course, the link between heart disease and obesity is just multifaceted. It triggers inflammatory processes that can harm your cardiovascular system. It can produce type 2 diabetes and things of that nature. Making matters worse, high blood pressure that's brought on by obesity irritates the plaque inside the arteries and predisposes it to rupture. We don't want that. It can cause sleep apnea, being overweight. Inflammation and factors, we talked about that before. It can lead to heart arrhythmias, atrial fibrillation. It causes, if you have extra pounds of fat to push through blood vessels, it just puts more pressure on your heart. And if you just, can lose a few pounds, losing as little as 5 pounds takes a lot of stress off your heart, and it can affect your blood pressure. I notice when people lose weight and they come in and get adjusted, honestly, they adjust so much easier after they've lost some weight. It just takes so much stress. The more extra weight you put on your body, the more it stresses you all over. So if you're going to do it on your own, like try to lose weight, the guidelines are stick with a diet that's filled with fruits and vegetables, whole grains, low-fat dairy products. And honestly, I would stay away from dairy if I could. Fatty fish, skinless poultry, nuts, legumes, healthy cooking oils, olive, walnut. Stay away from highly processed foods. Try to, if you're going to have saturated fatty acids, get the good quality stuff. And you can just do a little research on your own. I'm not a nutritionist, but I know the foods we eat are so very important. You saw that in the last video. So watch what you put in your mouth. Make sure it's good for you, and be smart. Okay, all right. So now I went on the website for the American Heart Association, and it's got recommendations for physical activity. I'm just going to read this to you. So much of this you already know, but I'm going to say it again because maybe it'll click. The people that I know that have a lot of heart problems don't tend to exercise the way they should. So let's you and I do better. So it says get 150 minutes of exercise every week. So that's 30 minutes, 5 days a week. Okay, so if you can do something for 30 minutes, then you can add later, high, moderate intensity, spend less time sitting. All of us sit too much, especially with COVID, and we're sitting home, etc. Gain more benefits from being active. The more you're active, the more benefit you get, obviously. Recommendation for children, they need to move. I grew up in an era where the kids were outside, and of course that's not happening today. All the kids are inside, they have their own phone, they got these games to play. We got to get our kids to be more active because we're going to see more problems with their children's hearts as, if they don't exercise, and that. Okay, so intensity. So examples of moderate exercise, walk briskly. Maybe 2.5 miles an hour. Just walk like a fast walk and get your body moving. Water aerobics are great if you have a place you can go. Dancing, ballroom, or social. Wouldn't it be nice to go out dancing? When was the last time we could? Gardening. I'm not a gardener, but I have a lot of patients that are, so get out there and dig in the dirt. Tennis, playing tennis, that's great. Tennis is awesome. Biking, not a race biker, but just biking slower than 10 miles an hour. Hiking uphill with a heavy backpack, well, that'll get you in shape. I'll just try hiking up the hill without a heavy backpack and see how that goes. Running if you can. If you do run, bounce on the balls of your feet, not on your heels. If you bounce on the balls of your feet, it's much better on your spine. Swimming laps if you can. Aerobic dancing, of course. Yard work, cycling, jumping rope. Oh man. If you want to know just how much out of shape you are, try jumping rope. That's a wake-up call. So if you do all these things, just do something, move your body. So some of the benefits are, and I'll read these, you lower the risk of your heart disease, stroke, type 2 diabetes, high blood pressure. You get better sleep. Just work out really hard before you go to bed at night, and you'll probably sleep a whole lot better. Better sleep, including improvements in insomnia, obstructive sleep apnea, those things. improved cognition. You know, the more blood flow you get to your brain. It's all about blood flow, especially as we get older. You want to keep as much blood flow going to that brain as you can because it needs it. And exercise helps with that. It also helps with your perceptive system. You know, like the more your feet are on the ground and the more you're moving your body around, it helps your brain to get all this feedback, and it helps your balance issues. There's so much information. Less weight gain, obesity related to chronic health problems. You got better bone health. You're less likely to get osteoporosis if you're out there doing exercise. Less risk of injuries and falls. Fewer symptoms of depression, anxiety. You know, exercise is motion, and then your emotions are emotion. So the more if you're feeling down, depressed, or discouraged, just get up and start moving. The more you move your body, the less likely you'll be discouraged. Better quality of life and a sense of overall well-being. So move your body. I read a Jim Rohn quote earlier today, and whatever you don't exercise, you lose. Whether it's your courage or your risk-taking or your exercise, you have to move your body. You have to get out there and make things happen. So realize that we're all struggling with being overweight and being obese. All of us fight this battle. Be careful what you're putting in your mouth, and then move your body. The key is just to exercise and burn more calories than you're putting in your mouth. And so that's the key. So thank you for listening. I'll see you on the next visit, and take care of yourself. Bye-bye.